Hello and welcome to a discussion on corona vaccine. Yes, many of us have been wondering on corona vaccine, particularly the reluctance that we have observed. All, though, have a right to decide after weighing the pros and cons with the experts. But what we have seen is we have been made to decide with inputs from social media and online platforms which are unverified informations. But we have with us here in the studios of DD Nagaland to discuss and bring this authentic information on corona vaccine. And with me here in the studio is Dr. Ritu Thur, State Media Spokesperson, and Mr. H. Chishi, Senior Journalist, President, Nagaland Press Association. Gentlemen, thank you for sparing your time.
Thank you.
Well, Doctor, to begin with you, would you like to tell us the basics of coronavirus preventive measures once again?
Thank you. We still advocate COVID-appropriate behaviors, like we have to practice 3 Ws, that is washing hand, watching our distance, and wearing mask. These are the basic information that we have to practice.
Okay, washing hands, wearing masks, and watching our distance.
Exactly.
Very important points to keep in mind. Well, carrying on with the the coronavirus again, doctor, we have a tendency, publics have a tendency to forget quite easily. So, would you like to refresh our minds on the signs and symptoms of coronavirus once again?
Yeah, it is a very simple, like a common flu. The signs and symptoms, common signs and symptoms are fever, runny nose, body ache, throat pain. These are the common signs and symptoms usually experienced by the patients.
I see. Well, viewers, I have just received my second dose of COVID vaccine from Naga Hospital today, and here I am conducting the interview. All is well with me, even in the first vaccination dose, and today I'm very happy that I have received my second dose as well. And all my panelists here have also received their vaccinations. And doctor, since the vaccinations has been rolled out in Nagaland, how is it going now?
Well, the COVID-19 vaccination drive was launched on 16 January 2021.
Mm-hmm.
Initially prioritizing the healthcare workers and frontline workers.
Mm-hmm.
And from 1st March 2021 onward, again, age-appropriate group like 60 years and above and 45 to 59 years age group with the comorbidities were also identified for vaccination. Till as of now, we could have achieved 81,525 doses of both all the categories.
I see.
And in our state, the vaccination process is very slow, but slowly and gradually our people are picking up and coming to the vaccination center with more awareness.
I see.
From the public.
Okay, I think that's a great information, and we should get more of this awareness going out to the people, and the people should also realize that vaccination to loboi lage ityadu. Chishi, you have also taken your vaccination,
Yes.
and I'm curious, what was your experience before going to the vaccination booth and after the vaccination?
Definitely, I was quite nervous, but otherwise, there's nothing to fear. And, it's a normal, it's a normal vaccination. Then I have completed my second dose also. So people should come forward and avail this opportunity given by the government.
Correct.
Yeah.
Even me, maybe first dose low let them bui lagi daise. But definitely after an interview with one Dr. Rupert, and I got takot bui na lagi gina ro ai gina at low la lagi kuina jagina loi loise. And today second dose pi loise aro muja pra interview conduct kuri ase moi karne to laphe lap ho ase
Yeah, good.
yeah so doctor COVID-19 vaccine is given to specific age groups, specific population as of now, and who are these people who are eligible, and will it be provided to the people who doesn't come under the specific age group anytime soon?
Yeah. As of now, we are following the Government of India directive, but from 1st April onward, individuals more than 45 years age group will be eligible to receive the vaccine.
I see.
Other age group will be notified by the Government of India later, so we are waiting for the directive from the Government of India.
Achha.
As I've said, right now we are following the age appropriate group, and which are all the vaccines are free of cost for all the public to get the vaccination.
Achha. So 1st April bra 45 age hoa khan aro idu opor khan du sob manu bi vaccination lobole paribo.
Yes. Yes.
Okay, that's good news for those people who come under that bracket of 45 years old, 45 years and above. Yeah. So keep in mind and get yourself vaccinated. That's an important thing. Getting to Mr. Chishi. Chishi, what is your observation on our behavior, the common public's behavior with regard to preventive measures? Do you think we are helping, the public behavior is helping in the fight against this coronavirus?
Definitely, as a media person, I could observe, a lot of stakeholders have come in, government has also roped in lots of NGOs, organizations, civil society organizations. I think it has really helped the government to contain this spread of virus. And I think this should continue here in any case. And when you talk about the personal behavior, also I could observe people are very much aware of this. So that's why our state is not on the higher side now.
It's on the lower side.
Yeah. So that is the positive sign.
So, dear viewers, it is important to note that the medical fraternity, the government of Nagaland, and responsible agencies, and you and I, the common people, we are also helping. But in case in any of our behaviors, if we forget to wear masks, then let us remember that it is you and I who will help. Ekta ke modok kurigine mask lagaigine distance rakhigine mohan he coronavirus to fight kurule mohan bi support dibole lage itu bi babi sabide koigine itu janai diase. So doctor, well, what is the procedure for eligible population? Etia 45 years and above ke vaccination lobole paribo ko ase 1st April pra.
Yes.
To tahan ki kuri kenega kuri gine vaccination lobole paribo kiba measures ase niki
etu
steps
duta rasta ase ekta tu nijo online par bi registration koribo pare at the rate of cowin.gov.in kon tate par bi online registration koribo pare na hole bi apni vaccination lobo kole amakhan etia sob district hospital de na hole bi PSC CSC can be notified as COVID vaccination center.
Acha.
So amakhan nijo ID card lo jai na government ID proof na hole bi Aadhaar card lo jai na side registration korina aram bara vaccine lobo pare.
Acha.
Very simple. Eta to beshi sosta ase etu karne chinta na korbi.
Kali buibra hai olabi
হয় তো
aro moi khan bi vaccine logina ase sob thik ase itu nisna buibra olabi doctor khan information sob di ase itu biswas koribi not on WhatsApp or online platforms khan bra kiba dia itu na itu dimag te duri gine rakhi na dibi olibi ulai gine government bra service dia ase itu lobby kwa chishi getting back to you how can we help further as media people to supplement the efforts of the government fighting the coronavirus?
See, as a responsible media and as a mainstream media in the state, we have been extending our support to the state government in a fight against this pandemic in the form of disseminating factual and correct report because we are at the same time we are also fighting infodemic misinformation and then one thing people must understand is that the media is also one of the frontline workers
Truly
truly. So in this effort we are doing a lot then we have helped the government a lot and then we will continue to do that.
I see that's a very important point because the role of media and our own local media needs to rise up and be able to support the efforts of the government. Otherwise, we are all bombarded with all those unverified informations and news as well. Well, getting on with you, Doctor, has there been any report of vaccine-related illness, complications, or death so far in Nagaland?
Yeah, after vaccination, we call it the minor side effects called fever, body ache, headache, malaise. This is a very common side effect. And if you develop such signs and symptoms, it is a good sign that your body is responding to the immune system. But like a severe side effect and death has not been reported in our state so far.
That's very good, and I hope it continues that way with more recoveries and less infections as well. So thankfully we have a very high percentage of recoveries, but will these recovered people ever carry any health disadvantage due to the infection that they have gone through?
In the long-term study has proved that the COVID infection is still difficult to understand. But if a person is already recovered from the infection, chances of spreading infections to others is not very less. But reinfection may occur. That is as per the studies reveal.
I see. That's an important point, Doctor. Jodi ekta manu coronavirus lagise aro bal hoise enega koile tu idu du bishi bal kotha ase aro etia bi study du chuli ase hole etia top tu health disadvantage dusra ekta enega du iman dikhia nai hoile bi jodi more khan mask khan laga nai hand washing khan kura nai SOP follow kura nai kole du mohan aro reinfection hobole pare এইটো কৈছে ডক্টৰ তো মোহন ভ্যাকসিনেশন হৈছে মোহন কেনেকা হ'ব
না আমাক vaccine fully vaccinated মানে দুটা ডোজ লোৱা খানটো as per the expert recommendation that you are free, you may not get the reinfection.
I see.
If you are fully vaccinated 2 doses, but your body will develop a full immunity after 2 weeks of the second dose. That is as per the expert recommendation about the present corona vaccines.
Doctor, idu coronavirus the infection hoise aro recovery bi hoise to itu manu khan karne ki advice dibo apni
vaccine loise aro recover hoise kole bi mon dangor na koribo lage. We have to still practice COVID appropriate behavior. Mane hotai koi thake mask tu lagabo lagibo aro crowded place te man na jabo lagibo. Washing hands, sanitization, we have to keep on practicing.
Acha. Okay, that's good. That's
Yeah.
great. We still, I mean, it should develop into a habit now,
Yeah,
all
habit.
these good practices, and that way it's going to keep us safe
Yes,
only.
exactly.
Well, Mr. Chiship, the social media and online platform has time and again proved its power, and this we have seen in this coronavirus time as well. So what is your comment to enable a positive impact even by platforms such as this?
There are advantage and disadvantage of this social media.
Mhm.
It's a fastest means of disseminating information
Mhm.
to the masses,
Mhm.
but also at this juncture,
Mhm.
during this pandemic period, we are fighting on two fronts: pandemic as well as infodemic and misinformation.
Mhm.
Yeah.
Mhm.
So
Yes.
when we recollect back some 2-3 years ago, years back,
Mm.
there was a rubella vaccine
Mhm.
vaccination which was introduced
Mhm.
in the country. There was a loss of misinformation from the social media sector also, where
Mhm.
people were reluctant to take that
Uh-huh. Uh-huh.
vaccination. So this is the power of social media.
Uh-huh.
So we have to be very careful. We have to depend on the mainstream media,
Uh-huh.
like
Mhm.
regular newspaper,
Mhm.
TV,
Yes. Okay.
online journal.
Mhm. So the best thing is, if even if any unverified information comes to any one of us in social media platforms, the best advice would be not to share further.
Yeah.
Because it is unverified news.
Yeah.
Well, doctor, getting on with you, we hear the lung is one main organ affected. So has there been cases like that reported in Nagaland, even among those who have recovered from the infection?
Yes, COVID-19 infection is mainly spread through respiratory system. That is our main lungs infection is very common. From the data report from the department that we have received a lot of cases of those recovered individuals where their lung damage was done, but the recovery is very slow, and definitely they'll improve in the later part of their age.
Just my curiosity, quickly once again, a recovered COVID vaccine will not infect others.
Yes, when we say that a person is recovered or declared cure,
Uh-huh.
definitely he or she will not infect others.
Mhm.
But let us remember that he or she has to practice again the COVID appropriate behavior in the society.
And he or she can also get infected again, reinfected again.
Reinfection can be
Okay.
occur.
Okay, we have to keep those things in mind, yes. So has there been any report of, in Nagaland, of the mutant variant of corona?
Yeah, so far in our state that mutant variant coronavirus has not been reported till then.
Then if it ever comes, and for us people who are vaccinated, will the vaccination that we receive prevent us from the infection of the mutant variant?
Yes, all the vaccines which we are using in our country, in our state, Covaxin and Covishield, as per the study, prove that they are multiple immunities is against the variant types of vaccines, corona vaccines. So definitely taking the full doses of corona vaccines will prevent even the rising mutant variant in our country.
So, Doctor, what is your observation with regard to second wave hitting Nagaland? At this rate of the vaccination drive that is going on, at this rate of the common people's behavior with regard to SOP, do you think the second wave is likely to hit Nagaland, as is been, flashed in TV and media platforms about places in metros where second wave is likely to come, lockdown is likely to come? What about Nagaland?
You see, COVID-19 infection comes in a wave, as we have evidence in the country, in the state. The first wave came to Nagaland 2 to 3 months after the first cases report in the country. So this time it may come to us sooner, as our borders are open free. The best way now is to protect ourselves with is vaccine and observe COVID-appropriate behavior.
Achha.
So COVID-19 is going to stay here with us for a while, and we should know how to live with COVID.
Yes.
Well, definitely a very important thing for us to keep in mind. For the information of our viewers, let me just look at these things. India reported 68,020 new COVID-19 cases, 291 deaths in the last 24 hours, as reported on Monday. So the cases are increasing, huge increasing, very very much, and we need to be in the state of alertness and not be complacent. Getting with you, Mr. Chishi, we have seen a lot of community-based organizations, churches, voluntary agencies, and even prominent citizens helping when quarantine centers were full swing in 2020. Do you think these goodwill contributions should continue, and should they also help in the vaccine mission? In other words, sharing, spreading corona vaccine vaccination awareness to the people.
Oh, definitely, because we have witnessed, we have experienced the overwhelming response from the people, the NGOs, the church. It was really overwhelming. They came forward and supported the government. Yes, definitely. I think the correct information we have to disseminate through this, organization like church.
Yes.
Church is a very influential body in the state.
Truly.
Many people are not coming forward still to take the vaccine. Even the health workers too. So I think we have to utilize this, utilize the services of the organizations, church,
voluntary agencies, even NGOs, so that we are able to generate wide awareness on the importance and the value
widespread,
of the
awareness campaign, and then to overcome this misinformation.
Well, Doctor, I'm a person who really likes to travel. So this question, does the government have any protocol that vaccinated person will not require testing when traveling to other state or even coming into the
Yes, as per the protocol, individuals who have received 2 doses of vaccination need not to go for testing, so they can travel anywhere.
Oh, then the certificate that I got online today after my second dose, that will suffice for me to not go through the process of, for me, I feel it is traumatic to go through that process of testing and be able to travel freely, right?
Exactly.
Oh.
That become your certificate not to go under quarantine.
Aha, that's great, that's great. Good news for me and all the people who are, keen and eager to travel. Yeah. So if you have taken your second dose, and you will get an online certificate just like I did today. So use that and be able to travel. But always remember that you need to follow the 3 Ws and the SOP of whatever place that you are traveling into. Well, Doctor, last few questions. What is your advice to children who will be starting full school routine on COVID-19 prevention?
In my opinion, I would like to request our school authority to strictly enforce the SOP and also to ensure that appropriate COVID behavior is practiced in the school campus with the, as we always said about 3W, wearing masks, washing hand, and distance keeping is a mandatory to prevent. It is an important tools to prevent the infection and the control of the COVID-19 spread.
I think that's very important. Mr. Chishi, any last comment would you like to share with our viewers?
No, as I've stated, I think we should not be complacent with the virus. I think we have to overcome the misinformation, misgivings, and then infodemic, which is bombarding, which is making people more nervous about this vaccine. There's nothing to get scared of, nothing to fear. We have to come forward and take this dose.
Truly.
We want to be safe.
Truly. Aro Sabina, Mohan world leaders kan down sab kan doctors kan sab to vaccine lo ase aro moi kan he bui lagi kine etu noloi kine thagile kine ka hona etu I think all those misinformations have to go, and also look at the facts that is happening in the world global level as well. But well, viewers, let me just bring you for your general information that in Nagaland we have 12,233 positive cases, which, let me put it this way, 11,980 have recovered. Now that's important to keep in mind. We have only 8 active cases, while unfortunately we have had 81 deaths as per the reports received on 29th March 2021. I just want to re-emphasize the 3 W's. Watch your distance, wear masks, and washing hands. Just like me, I feel you are still confused like me. I have a poor memory. 3 W's, watch your distance, and wear masks, and wash your hands. These are the 3 W's which are very important. And if I may also add, Mohan hand washing kurubula lagibo, mood aron nat kan sob bon kurubula lagibo, kitiaba hachi koine, kitiaba sordi lagi cough kore idutemde mood nat kan sob bon kurubi. Agede kwan is na watch your distance. Komti hole be 6 feet distance to rakibi. Aro jodi parat up to manu sordi zukam hogine thaga khan ge close te samne te itu khan lob dur thagile bal itu samne na jaile he bal ase aro of course spray kuribi aro regular gor safa kura khan saman khan logine spray kuribi wipe kuribi sob manu chua laga jaga khan eneka kurigine government bra doctor khan bra mohanke SOP koigine dise itu follow kuribi aro doctor bra age de kwanisna bacha khan school de jagine thaka khan suru hoy ase tia full swing suru hoy ase dugana itu bi jane gine bacha khan bishi important message doctor bra apni khan ge koy ase de ki apnar khan 3 W's to follow kuribi school de jadam de tanaka hoile he mohan coronavirus para dur thakibole paribo mohan unfortunate news kan murishe naga news na hibo infection hoise naga news na hibo nohale du etia aro second wave ahibole nisna hoise koina manu pui khaise mohan itu para dur thakibole garne 3 W's etu janibi de kokine janai diase. Thank you, Doctor and Mr. Chishi. Thank you so much for sparing your time to Didi, and we are hopeful that our viewers have benefited from this program as well. Thank you.
Thank you.
Thank you, everybody.
Thank you.